Opioids as a family include everything from opium, which is the sap that comes from the opium poppy, to things like morphine, medications such as hydrocodone, oxycodone, Demerol, fentanyl, Percocet is in that, methadone is in that family. Also illegal substances such as heroin. These are all opioids. They're just different versions, but they all contain the same type of chemical and they all work in the exact same way in the brain and have the same effects. They are all equally addictive. They are all equally dangerous if used in excess or in combination with other dangerous substances. Their chemical structure is very similar. And so whether it's oxycodone or heroin, these are almost identical. They're certainly the same to the brain. And I think this is important because some people think that heroin is very dangerous and some people can die from that. And some people think that, well, a medicine like oxycodone is safe because it's prescribed, it's a medication, and it's just as dangerous as heroin in terms of accidental lethal overdose.
Very effective drugs for pain control. And what they do is they go into the brain and they go to the pain system. They affect certain transmitters that help block pain. And the problem is those same drugs will also affect the pleasure centers in the brain. So there's a natural part of our brain that feels good when we do good things, like we eat good food, we get good sleep, we do something that's fun. Basically, what some chemicals do and what some drugs do, like opiates, is they will hijack that system. And they will give you an unnatural high, essentially, that feels really good. Where the danger comes in, I think, for a lot of addicted substances is they actually can cause changes in the brain. Your brain is still evolving up until your mid-20s. So the younger someone is, the more likely it is they're going to have an effect on their brain and be more severely addicted down the line and have a harder time quitting.
The brain is very good at learning pleasure and learning to want more pleasure. So with repeated activation of these opiate receptors with opiates, the brain can learn more and more to want them.
And then eventually, because it hijacks that system, the brain will try to adapt and make less of the natural chemicals in your brain that make you feel well and help you feel good. And you become dependent on having those opiate chemicals in your brain. At that point, not just to feel a high or feel elated, but to feel normal. And that's what gets folks into trouble, because by then you're addicted. If you try to stop the opiate, you will have extremely uncomfortable symptoms, extremely painful symptoms. With opiates, particularly severe anxiety, stomach problems, vomiting, diarrhea, tremors, pain. It's not fatal, but you feel like you want to die. And so what can happen for some folks is that when they take these drugs, and it depends on the drug, depends on how they take it, and actually depends some on the genetics, because some of us are more susceptible to abusing drugs based on our genes. For example, there's some folks that take opiates and they hate the way it makes them feel.
Other people are particularly sensitive to the benefits or the pleasure that can be caused by opiates. And some of this is because they have genes that make them more likely to respond that way. This is why we see addictions run in families.
If an opiate is recommended, and again, that's usually a fracture, something to that degree, a broken clavicle, a fractured femur, that kind of thing. And an opiate's being recommended, make sure that the doctor is giving the lowest effective dose, the lowest number of pills, and again, rarely is more than just a few days, maybe 3 days needed. Make sure there aren't refills, because that's usually done for the convenience of both the doctor and perhaps the parents. If the pain is still there to the point that opiates are needed after a few days, it's time to call the doctor again and have the pain reevaluated.